But when Brian Sloan started to feel shooting pains in his back and neck, he never dreamed where they would lead.
The pain that I had in my neck was a sharp pain when I would turn my head, but the pain between my shoulder blade and my spine, certain activities, throwing a ball, doing exercises like push-ups and things like that, really aggravated that area.
I just figured it was from being active and being involved in a stressful job.
Brian chalks it up to years of wear and tear from playing sports. He gradually learns to live with what he assumes are just the aches and pains of getting older. Then, 5 years later, a new and seemingly unrelated symptom appears.
I would feel a burning sensation in my chest, like a tugging or a pulling sensation in my esophagus when food would pass.
Brian goes to see his family doctor, and she orders an endoscopy, a procedure in which a tiny camera is inserted down the throat and into the esophagus.
They said that it looked to have a little bit of esophagitis, which is a slight erosion of the esophagus.
Esophagitis is often caused by acid reflux, in which acid from the stomach backs up into the esophagus and irritates the lining. The doctor prescribes some antacid drugs, but the pain in Brian's esophagus keeps getting worse.
And when I would talk, my chest would vibrate and have a sensation that would cause me to want to cough. My chest felt like a golf ball was wedged up between my esophagus and my windpipe.
Assuming it's more fallout from the esophagitis, Brian tries experimenting with a healthier diet, but it doesn't help. One day, the pain is so severe that he thinks he's having a heart attack. He rushes to the emergency room.
EKGs turned out normal. All of the heart tests turned out normal. Blood work turned out normal.
I started wondering, have they missed something totally? Like, do I have tumors growing in my chest or something like that? And they're not going to find out till it's just too late.
For the past 5 years, 37-year-old Brian Sloan has been racked with paralyzing pain in his back and neck that no one can diagnose. He is beginning to think he'll have to live with it forever when an alarming new symptom strikes.
I would reach out to operate the computer with my right arm forward, and I would feel my hand going numb.
It was difficult for him to grasp things or pick things up.
This sudden muscle weakness worries Brian and his primary care doctor, who immediately refers him to a neurologist, Dr. Rabindra Kitchener.
Surprisingly, I couldn't find much on the examination, so that's when we proceeded to do a procedure called an electromyogram. It's a test that's done to check for nerve damage and muscle damage, and these studies came back as being normal. And that's when we got an MRI of the brain and his neck and his back. These studies were also normal.
Kitchener administers test after test, but nothing shows up. He eventually prescribes pain relievers, which help enough for Brian to get by.
It was a strange pain because it would come and go. I thought maybe that something just can't be answered.
Then, 1 year later at a company baseball game, what had been just aches and pains suddenly turned into something much scarier.
I hit the ball. When I got to third base, I really had to make an effort to get in as much air as I could.
He came home and was holding his chest.
It felt like something had been ripped from the inside of my chest.
They quickly grab Brian's medical files and head back to the ER.
They checked him out as far as an EKG and a chest x-ray.
I asked him if he thought it was a heart attack because the pains were so severe.
But again, the tests all come back negative. Nothing appears to be wrong with Brian. The doctor prescribes more pain medication and tells him there's nothing more he can do. Brian is crushed. He tries to go on with his normal life, but he knows that won't last for long.
I kept wondering, at what point am I not going to be able to pretend everything's okay?
I can picture him sitting at the kitchen table with his head down and holding his head in his hands and saying, I can't go on like this. And I know there were times he felt like giving up.
I knew at some point, at this rate that it was progressing, I would be forced to stop.
Then, in August of 2004, 8 years since all of this started, yet another bizarre symptom begins to surface.
I began having muscle twitches in all different muscle groups in my body. You could actually see the muscles jumping on my legs, on my arms, and they began to move into my face and into my eyelid.
Completely distraught, Brian returns to the neurologist he saw the year before. Dr. Kitchener is extremely interested in the new symptom Brian describes.
He said that every time he coughed or sneezed, he would get lightheaded and his right eye would begin to droop and twitch. This is an unusual symptom, but there are many nerves that go from the upper part of the chest, they go to the central nervous system.
Dr. Kitchener immediately orders a CAT scan of Brian's chest, which is more sensitive than the standard X-rays Brian has had. The results are shocking.
He did have a mass in the upper part of his chest, and the initial concern was that it may be a malignancy.
So that was extremely scary. And they ordered a biopsy to see if it was cancerous.
You begin to, worry that, hey, am I going to be around here to raise my kids?
2 weeks later, the results of the biopsy are back, and they show no trace of cancer.
So at this point, I was pretty excited that that was not going to be my battle, but I was still wanting to know what it was.
The mass that is shown up on the CAT scan appears to be an abnormally large lymph node. Lymph nodes are the tiny structures in the body that filter out and destroy bacteria and viruses. Although Brian's lymph nodes are cancer-free, the biopsy shows that they contain something very strange: rock-hard calcium deposits.
In his case, it was fairly large, and that meant that he needed to have further studies done.
If they're to find out anything more, the lymph nodes will have to be removed surgically. 2 weeks later, Brian is in the office of thoracic surgeon Dr. Peter Pavlina.
Sometimes in the process of fighting infection, inflammatory processes occur which ultimately lead to the body producing calcium, making the lymph nodes very hard. When I saw Brian and I saw his films, my impression was that these calcified lymph nodes meant that he had a previous infection.
And he told me the only way to really get to these things was a thoracotomy. Basically, they go into your back and spread your ribs apart to go in to your chest to retrieve these things.
The procedure is extremely risky.
The primary dangers are massive bleeding, which could occur with an inadvertent injury to the heart or to the main pulmonary artery, which is the main artery that supplies blood to the lung.
In April 2005, after living with the symptoms for 9 years, Brian is admitted to the hospital for surgery. He and Amy are terrified.
We arrived at the hospital early in the morning, and my mom was going to meet us at the hospital, but she wasn't there yet. And so I was there by myself. And I just remember that fear of when they took him back there.
The biggest concerns I had were for my wife and for my kids. If something went wrong in surgery, that she would have to raise the kids by herself and the kids wouldn't have a father.
"41-year-old Brian Sloan is being wheeled into the operating room, where he's about to undergo an extremely risky surgery. At 9 a.m., surgeon Peter Pavlina makes a 6-inch incision in Brian's back, then collapses his right lung in order to get a look at his lymph nodes. What he finds inside is astonishing.
It was pretty messed up. We found a very inflamed, heavily calcified mass located directly on top of his esophagus and compressing part of his heart.
The extent of the damage is staggering. Brian's lymph nodes are almost entirely calcified, like stones sitting in the middle of his chest.
Now, this is a very busy area of the body. The respiratory system has major structures there. The vascular system, the heart, the major blood vessels, and the esophagus is all coming together at this area.
The rock-hard lymph nodes have constricted all the surrounding organs and blood vessels, causing Brian's terrible chest and throat pain. But now Dr. Pavlina can see why Brian was experiencing symptoms in his extremities too.
The lymph nodes were trapping nerves and pressing on them. He felt pains in other locations in his body because that's how his brain perceived the pain.
Dr. Pavlina has done thousands of surgeries, but this one is going to be extremely difficult.
Normally I can take a forceps and grab that lymph node and pluck it like a grape. But in this situation, it's more like a piece of concrete that is stuck to the heart.
Finally, after 4 hours of painstaking work, Dr. Pavlina and his team are done.
Dr. Pavlina came in and said that everything went really well and that he felt like they had gotten all of the calcification. So at that point, there was a flood of relief.
Meanwhile, the damaged lymph nodes have been sent to the lab to see what could have caused this severe reaction to begin with.
It came back showing nothing really in the lymph nodes, and he thought that the only thing left was histoplasmosis.
Histoplasmosis is a common respiratory infection that has affected up to 50 million Americans. It's caused when fungus spores found in bird and bat droppings are inhaled into the lungs. The symptoms are similar to those of the common cold or flu. Most people recover without even knowing they've been infected. But in a very few cases, patients react abnormally and develop calcified lymph nodes over time.
Brian had a very unusual reaction to a very common disease. Why does it happen in one and not 1,000 other people? We don't know.
After 5 days recovering from the surgery, Brian is well enough to go home.
I noticed right away that when I swallowed, I did not have the sensation in my esophagus.
Brian's myriad symptoms vanish almost overnight. But had the mass not been identified when it was, the results could have been deadly.
According to Dr. Pavlina, the calcified lymph nodes had almost perforated through his esophagus.
The esophagus is here, the trachea is here, the lymph node is here. It erodes both ways, and then eventually there's like a tract. And the biggest danger is recurrent pneumonia.
6 months after his operation, Brian feels better than he has in years. He and Amy are grateful to Dr. Kitchener and Dr. Pavlina for catching and curing his condition. But they still wonder why he had to suffer for 9 years before getting a diagnosis.
Physicians oftentimes don't connect pathology within the center of the chest with pains that seem to be produced outside of the chest.
I feel like I've been given my life back and able to enjoy my kids and do things that I normally wouldn't have had the energy to be able to do it.
The experience has taught Brian, his family, and his doctors a valuable lesson.
You just got to keep pushing on until you get the solution that's right for you and that brings you relief from what it is you're suffering from.
Brian Sloan had a very unusual reaction to a common infection.